afternoon, everyone, and welcome to Cormier's Book Club. Today we're going to be discussing Prednisone-Putting Out the Fire. Now that we're all comfortable in our pajamas, I hope that you all are too. I hope that you all can tweet us any ideas that you may have at #PuttingOutTheFire. Our character is Mary Jane, and currently she's taking prednisone. I'm just going to have my friend Kendra here give you a brief background on what prednisone is.
Prednisone is a glucocorticoid receptor agonist. It is metabolized in the liver to its active form, prednisolone. Prednisolone crosses the cell membrane and binds with high affinity to specific cytoplasmic receptors. Results are inhibition of leukocyte infiltration at the site of inflammation, interference in the function of mediators of inflammatory response, suppression of humoral immune response, and reduction in edema and scar tissue. Also, some of the indications of the drug, it says that it treats drug-induced allergic reactions, perennial or seasonal allergic rhinitis, contact dermatitis, ulcerative colitis, multiple sclerosis, acute or chronic lymphatic leukemia, and much more.
Well, sister, I commend you for doing your homework on that because I had no clue what prednisone was. But, you know, the one thing in the book where Mary Jane Doctor was talking to her about the pharmacokinetics, how he was telling her that it's well absorbed from many sites, it's metabolized mostly in the liver and excreted in the urine. It crosses the placenta and enters breast milk, so I feel so bad for her. If she ever gets pregnant, she has to discontinue this drug. Oh, and did y'all catch the part where it's only available in oral form?
No, I didn't know that.
I was just blown away by that. Oprah?
Oh, well, I thought the part was really intriguing when I found out the pathophysiology portion. This is when she went to her physician to pick up her prescription. So when she went to pick up her prescription, the physician told her that prednisone was a glucocorticoid that stimulates and can increase the glucose levels, meaning that she should be careful with what she eats, with her diet. And then it can also increase protein breakdown and the lack of protein production. And it can also cause lipogenesis, which increases her fat storage. So she really, really, really has to be cautious of her diet at this time. In addition to that, he just gave her some advice about some drug-to-drug, and it increases the therapeutic and toxic effects with estrogen and the risk for muscle and strength deterioration due to the lack of protein production. And it decreases the steroid blood glucose levels with barbiturates, phenytoin, and rifampin. And lastly, he informed her that she needs to discuss any allergies, any herbs that she's been taking, any other medications, if she's ever had an eye infection, diabetes, hypertension, myasthenia gravis, if she was ever pregnant or wanted to become pregnant, but because she's on the medication, she cannot, any vaccinations, and that it could decrease her ability to fight infections. So she needs to always wash her hands and stay away from people that were ill. So I feel like she learned a lot of information on her doctor's visit and gaining her prescription, and there was just a lot of information to be learned.
That's true. She did learn a lot from her doctor because her friend Shelly, you remember that? She asked her about the cautions, and she was like, I have diabetes, I have acute peptic ulcers, I have endocrine disorders, and I'm thinking about becoming pregnant. She's like, girl, you can't take that on this drug.
That's crazy. Oh, wow. Well, I remember you were just talking about infection, so that's an adverse effect of it. Did y'all catch that in the book?
Oh, wow. No, I didn't.
But that part where she started to bleed from her stomach, that was just crazy. I was just blown away from that. She was also having some trouble sleeping, and then, she had increased hunger. So, I mean, we know she needs to watch her diet, so good Lord. So, can I eat? Should I not eat? I don't know. This is just too much. And then, how her skin was just thin and fragile. I just felt so bad for her just reading this book. So sad, Mary Jane. But what else were you saying about earlier about the cautions?
Oh, the contraindications. Yeah, when she was talking to Jamila, and she's like, I'm allergic to steroid preparation. She's like, oh, you can't take this either because of that. And she's like, I have an acute infection, and if she was pregnant, she was going to be breastfeeding. So she's like, you can't it's just not going to work out.
No.
And also, didn't she have asthma?
Girl, oh my
Yes.
gosh. You know what? I've always had asthma ever since I was 2 years old. And my doctor has always put me on prednisone for the inflammation. But I really didn't know what it was. I mean, I just knew I just got fat off of it. I just looked a mess. My face was just bloated. But it really did help me, it helped my asthma. So I had to, the only thing that I remember from it is I just had to taper off the pills. So one day I was taking 4 pills. The next day I was taking 3, 2, then 1. And then I was like, ooh. Time to get back on this diet.
That's true. Because y'all remember she talked to her nurse?
Yeah.
She said she was monitoring the weight and checking the vital signs, renal function, endocrine function, monitoring her serum electrolytes. And then her implementation was to taper doses when discontinuing from high doses or from long-term therapy, and to space out multiple doses throughout the day evenly. And use alternate day maintenance therapy, which she's using short-acting drugs as well.
Oh, wow.
Yeah.
So we have someone, Celie, who tweeted us talking about that Mary Jane said that she needs to watch out for being fat and getting pregnant. Very true, Celie. Then we also have another Facebook retweet.
Oh yeah, Kelly. She talked about the evaluation to look at the patient's response. We forgot about that. Yeah, and the adverse effects, and to make sure that they're following the teaching plan.
Okay.
Oh, and I just received a tweet from Sarah.
Okay.
She's a physician in Michigan, and she was letting us know that another drug-to-drug that she should be aware of is lopinavir and nifedipine. She also let us know, and clozapine. She also said that she should be aware of those and not mix that with her prednisone.
Nice. Okay, awesome. Well, this was such a great book. I'm so happy I read this book. I really learned a lot. Thanks for the info earlier. That was just great.
Yeah. All right, and thank you all for joining us with our book discussion today. I hope you all return next week for our episode of Cormier's Book Club. We look forward to hearing you, and also you can continue to hashtag at Putting Out the Fire and tweet us and Facebook. Have a great evening.